I and I wanted more. I fell for policy because in my first year seminar class that I took a focus in on public health with inequalities and justices and that awareness in America. And I had Jeffrey Anderson, and he was my professor, and he helped me kind of fall in love with public health. And so I wanted to combine the sciences and nutrition and a public health background in my undergrad. And at the time, we didn't have the public health major, the foreign major, and I think some people decided to make it their own, like their own individualized major, excuse me. And I did not decide to do that. I decided to continue with nutrition dietetics because I wanted to be a registered dietitian in public health. So at the moment in my sophomore year, I thought with dietetics, then expand into possibly policy and different like mothers, like diversity in that with moms in Hennepin County. And so I graduated with nutrition dietetics, and I took that into Hennepin County's maternal and child health department. So I worked for WIC, their Women, Infants, and Children department for almost 2 years, or full 2 years, a little bit over 2 years. And at some point I knew I wanted more. I wanted my public health master's. So during COVID, while I was working from home in their WIC for Hennepin County, I decided to go for the graduate degree and apply. And I think it's a really good decision that I did that, because a lot of places that I want to go to next want that master's of public health. So I'm happy that I was able to bring my nutrition into public health. And so currently that's what I'm trying to do, is just align and connect everything. I love a more holistic focus. So I took anthropology classes, and I took a global policy class, and I took medical ethics because I wanted to combine the policy with my nutrition background for mothers of low income and underrepresented areas. So that's really my background so far.
Thank you, Aranza. I appreciate hearing too that, and I know Aranza pretty well, so I appreciate you coming today. But I appreciate the kind of meandering path, right? Like it took you a bit to figure out, and that is completely okay. Some of us know what we want to do with our lives, and some of us, they're stepping stones, right? So who's up? Who's next? Tessa.
I can go next, yeah. Okay. And I go next because Aranda, we have some intersections. This is really fun for me too, as I don't know the other panelists, so I can see some connection. So my name is Tessa Laswell. I use she, her, hers pronouns. I graduated from St. Ben's in 2015. I was a dietetics major, and I also was going the pre-med route. And at that time, there was not any coursework. Well, there was a little bit of coursework, but there wasn't any degree dedicated to public health. And I wanted public health, but at the time I didn't know that that was a field. I didn't really have the words for what that was. I took some coursework in the dietetics major, as well as studying abroad in South Africa, and saw nutrition really as the foundation to health, to really just all quality of life. And that really opened my eyes to what public health was, and that I really wanted public health. And that was the direction I wanted to move with my nutrition background. So after graduating, I went on to the University of Minnesota, and I also got my master's in public health. I did a coordinated program where I was able to complete my dietetic internship while taking the coursework for an MPH in nutrition. I stayed on then after finishing that program at the university, and I worked in the Division of Epidemiology and Community Health for about 3.5 years. I was a study coordinator on a few different public health studies, one specifically related to food assistance and the Supplemental Nutrition Assistance Program, and looking at different ways of evaluating the program and seeing if that has an impact on diet. I left that position in March of last year and accepted a job with the U.S. Department of Agriculture as a nutritionist with the Women, Infants, and Children's program, and then the Farmers Market and Senior Farmers Market programs. So I'm actually supporting the Northeast region. So think of like the New England area. I do a lot of policy analysis, interpretation, and audits of the programs in the different states. So yeah, I definitely took a bit of a weaving path, and I'm still figuring out where ultimately I'll land. And yeah, but definitely the degree at St. Ben's really set me up for success.
Thanks, Tessa. Okay, Jake and Liz, between the two of you, who's up?
I can
Liz.
go next.
Okay.
Yeah. Hi, my name is Liz Burning. I also graduated in 2019. My degree was general nutrition, so it was not the dietetics track. And then I also got a psychology minor with it as well. I came into St. Ben's pre-PT wanting to go through physical therapy, and kind of like midway, like through my sophomore year, I decided that I really wanted to focus on nutrition. And that allowed me to pick up the psychology minor as well, since food and health and psychology is often connected. So after graduating, I worked at the Emily program for a little over a year as a dietetic technician at one of their adult inpatient facilities. So I really discovered that I liked connecting with people on like their food journey and being like a resource for people to lean on. From there, I moved into my current position as a patient engagement representative for the Food RX program at Second Harvest Heartland. Second Harvest Heartland is a food bank located out of Brooklyn Park. So basically we're like the distribution hub for like food shelves and other like meal distribution sites in the community. And then the food bank also helps connect people with SNAP and advocating for policy changes and child hunger and all of those things. So the Food RX program is kind of interesting in the fact that it's a food prescription box for people who have chronic diseases. So diabetes, hypertension, ischemic heart disease, or congestive heart failure, excuse me. So we partner with local clinics and health plans to get these boxes out to people who are experiencing food insecurity, but also are trying to manage a chronic disease. So I do like the patient engagement side of that things. Yeah, my undergrad, I'm using it every day. Obviously, the knowledge in nutrition and providing health education to people who are trying to manage chronic disease through diet is like the core part of my job. So CSB set me up really good for that.
Awesome, thanks, Liz. And Jake, you're going to be really surprised to hear you're up.
All right, sounds good. How's it going, guys? So my name is Jake Weber. I was the class of 2013. Shout out to Linda. She was my advisor and professor. So I've gone through a couple different paths actually to where I end up today. I actually went the dietetics route and did the distance internship. So I went through Iowa State. I did my internship at St. Cloud Hospital. And then the thing I really enjoyed about that internship in particular was just all the different things I got exposed to, from public health to clinical food service and a bunch of other things. And so right after my internship, I actually went right into working more the clinical route. And was actually doing more with like cardiac rehab and things of that nature in a hospital setting, and just found it wasn't really the right fit for me. I wanted more to have more hands-on with patients, with clients. So I actually ended up with a healthcare system called Proactive Care Clinic. I was there for, gosh, over 5 years and was overseeing the different clinics nationwide. And I ended up actually leaving there and coming to my current company, Wellway, where I've been at now for a number of years. And Wellway is actually a little bit of a newer company. We started about 5 years ago. And it started up actually in the startup setting of things. So I got a lot of exposure to the business side of things, but also on the healthcare side of things. And so in essence, today, Wellway is a health services company changing the way healthcare gets delivered to clients and patients alike. And so within our clinics, so we actually have 5 clinics nationwide now. So we have 3 locations down in Florida, 1 in Kansas City, and then our headquarters here in Plymouth, Minnesota. And we're actually opening up about 4 to 6 new locations in the next 2 years. But essentially in our studios and our clinics, we have doctors, dietitians, personal trainers, massage therapy, acupuncture. We're going to be bringing in dentists. So we basically have everything from a healthcare setting standpoint. in one location for people so that they don't have to go to multiple different locations. And everybody has their hand in basically the care for that patient. So you're not just coming in working with the dietitian, you're not just coming in working with the doctor. There's kind of that collaborative approach. So I took more of the functional and integrative route. So outside of me working with clients on a day-to-day basis, I'm our National Health Services Specialist. So I oversee all of our dietitians at our different locations, and basically my job is to help support them in education, content, resources, coaching them. And that's just been a big passion point for me over the years, is just helping to develop other dietitians and make them successful. So I kind of have my foot in both camps, but then I also still oversee all of our supplementation and diagnostics / lab testing for the company as well too. So, but I would say, hands down, my time at St. John's and St. Ben's really set me up for success as far as the different exposures and different things that I got to do along the way, as far as seeing all the different facets of nutrition and being able to hone in on one. So really, really thankful for that.
Thank you all. I appreciate hearing. There's some similarities to your stories, but there's also some then really unique places you've taken this, which I think is exactly why we want you all as current students to hear, right? Like, there are amazing options. And you don't have to know what they are ahead of time. So we obviously started a little bit with more the academic path and how that connects, but I want to shift this a little bit, and I'd love to hear from you all about other activities you participated in while you were at St. Ben's and St. John's that really prepared you. I'll say two things, both for your career, at least as where you've been so far, as well as just you as a human being and as an alum. So what were those other activities you participated in that prepared you both for your career as well as just being a good human and an alum?
I can start on this one. I might be the one that's a little bit different than everybody else in the sense that I didn't live on campus. I transferred in after my freshman year. So I actually lived within the city of St. Cloud because I worked full time through my education. So all the years that I was at St. John's, St. Ben's, I actually worked full time in St. Cloud, lived off campus. And I think even that alone, it did restrict me a little bit as far as my time commitments to be able to do other extracurricular things. But being able to have those longer hours and actually, learn that work ethic and how do I balance these things and make sure I'm staying organized. That's definitely helped me regarding overall organizational skills, staying on top of things, but also too, just having that approach of being able to work with multiple different people and different types of personalities just from working and then also going to school. I mean, that was one of the biggest things, and just all the different exposures I got at St. Ben's and St. John's was definitely something that I was very fortunate to have.
Awesome, thanks. Okay, I'm looking for who's unmuting their microphone next.
I can go. Yeah. So for me, I didn't participate in anything like directly nutrition related while I was at St. Ben's. So while I was at St. Ben's, I worked at the circulation desk at Clemens. I was a part of the women's choir all 4 years. And then I was able to do a semester abroad in Australia my junior year. And really all of those experiences really taught me how to work with other people, how to communicate, how to juggle like that work-life school balance. I think those are probably the more core things that relate to the career field once you graduate.
Please know that's also why I expanded it to and also just who you are as an alum and human, because I think what you just articulated, it's the time management, it's the organizational, it's the communication. Those hugely apply to your daytime life, but they also apply to the other pieces of who you are. So thanks.
Yeah, absolutely.
Tessa.
I can go. I worked in terms of nutrition extracurriculars, I was involved with the nutrition club and then also as a TA, and those were both very valuable experiences. I really think to get a holistic view of the department, the faculty and other students that I wasn't seeing in my classes, and really apply the nutrition outside of the classroom. But then in addition to what Liz was saying, one of my other on-campus jobs was in the Student Employment Financial Aid Office. And at the time, I think I was a little bit confused with why I had selected that, because it didn't have a direct impact to nutrition. And at the same time, I think that that's really set me up well in my career to know that oftentimes all the tasks that I'm doing won't be specifically related to nutrition, and having to have a willingness and a flexibility to think outside of the box. And some of the programs that I used while in that position, I'm actually now using, and you just kind of never know when things that you don't think are going to show up in your career happen to pop up. And then I was also involved in JEC. Liz mentioned the women's choir. I was involved in all college choir. And I think it's those opportunities that really allowed me to seek out the balance. St. Ben's has very rigorous programs, and I think that that's partially why I chose it. And then also knowing that there is something to be said about the full life and the quality and making friendships and learning your hobbies. So yeah, there was a lot of opportunities to foster both pieces.
Thank you. Aranza.
I have so much to say. So I thought right away of XPD and the McCarthy Center. I swear I was with XPD every single month. I always had questions, and I wanted to see people who could look over my resume. I wanted information on how to give informational interviews. I wanted info on internships. Now I really made use of it, and I'm so glad that the people in the department work so well together too, because they really want to help you succeed as soon as you leave. They don't want you to be anxious about where your career is going to go, because St. Ben St. John's has so much connections all around the world that if you have a couple of curiosities, I'd say give some informational interviews. That helped me a lot with understanding people and their paths, because all paths.
Aranza, as you're talking, do you want to expand on what an informational interview is? Because I want to assume everyone in the room knows that.
Good point. Thank you. So an informational interview, the way I describe it is honestly having like a coffee date, either one-on-one or in person, or a walk with someone that you're curious to learn more about. You're curious about their career. You're curious about what they graduated with, and what classes they recommend. And they can get you hooked with other places if you're curious on Ramsey County, or if you're curious on Minnesota State Department of Health, some people that they could know there and they could link you with. So, so going off of that XPD, yes, please use it. Please, I can't say that enough. Use what is available to you. Even after I left St. Ben's, still able to connect with Angie and Laura Haymond, who work there, to assist with some questions I have, or if they want, if they have the time to assist me, which they did with my graduate plans and looking over some essays they did. Please use your professors as well. I also saw Linda a lot. Like, she was my advisor, and spanning on public health, she helped me because she was very public health savvy. She helped me expand nutrition into public health and like how to take my undergraduate degree further, because I ultimately knew junior year I wanted to enter public health career path, and public health expands into so many areas. So that was it's not easy to pin down something when it's not like just a doctor and it's a direct path, or a dentist and it's a very direct path. I feel like nutritionists do have a lot of doors open to do possible job experiences. And I did the nutrition club. I was a health advocate for work. I did like ELAC, like I forget what.
Latin American cultures.
Thank you. I'm like, I was ELAC. Thank you, Angie. And Urban Scholars. So St. Ben's also helped me get into Urban Scholars, which was an opportunity here in the Twin Cities that gets minorities into leadership positions. or people in underrepresented areas into leadership positions. So they helped me understand public health on the city aspect, like for the city of Minneapolis, as I worked for public health one summer, and then I worked for their administration team another summer. So those experiences plus what St. Ben's had gave me the opportunity to be a good candidate for Hennepin County's public health department.
And Aranza, more just because I know you super well, so this, you might just be like, Angie.
Go for
Also,
it.
after your sophomore year, what did you do that summer?
Oh, yes, I did. Thank you. So much to talk about, the Jackson Fellows program. So if you can apply to the Jackson Fellows, and please have a professor look over your application documents. The Jackson Fellows program helped me do an internship within Rochester, Minnesota, and Diversity Council nonprofit. So I did a lot of cultural related work to African Americans and Hispanic Latinos, the Latinx community there in Rochester. I was directly with families, directly helping with slam poetry in their art center, helping understand education for helping give more education opportunities for little kids that are like me, Latino and Hispanic, and helping families understand what opportunities they had. And then we were able to meet with like governors and those directly coordinating with governors and legislation. So that was a lot of good holistic also opportunity that I had there in Rochester. But the Jackson Fellows doesn't just place you in Minnesota, they also give you the option to go elsewhere and do other civic work, community engagement work. The community at St. Ben St. John's, you'll realize there's none like it. Like the community at St. Ben St. John's is unique, and it definitely cares for everyone. And yeah, it's just, I can't say that enough. I miss St. Ben St. John's a lot.
I'll stop picking on you now, Aranza. Just to kind of round that out too for those of you who are in the audience. So Jackson Fellows, we now actually umbrella it called the Summer Leadership Fellows. And so it includes Brandel through McCarthy, Jackson, which is joint between McCarthy and XPD, and then Fleischaker. So long story short, don't worry about the funding, but basically we last summer had about 60-ish students we were able to fund for summer internships in the nonprofit and government sectors. So that's what Aranza is talking about. It's a great way to explore a field. Adia, who's in the back, her and I, as well as Matt Lindstrom, run that program. You receive $6,000 to do, again, an internship in nonprofit or government sector. We guide you, but we don't pick the sites for you. And so it's really about what do you want to explore. Like, let's say you're a Nutrition 240 and you're like, I'm super interested in XYZ concept. That's where you can then explore in an internship site and then receive funding toward it. So the application deadline is coming up December 5th. So more information is on XPD's website, but I wanted to kind of round out. The other piece, I appreciate all four of you mentioning, we'll see quite a bit in XPD where I think sometimes there's this disconnect where I think current students might believe like, well, I can only talk about my paid experiences or things that are quote unquote work. And so the reason I asked the four of you those, what are those other really pivotal experiences? It might be an unpaid internship. It might be study abroad. It might be the experience of living off of campus. Like it might be the clubs you're in. It might be the employment you have. But all of those are pieces that help articulate who you are as a person. And so I appreciate all of you mentioning that. I'm wondering if the four of you can talk about, because you're coming at this from related but different fields. Can you talk about trends you're seeing in the field, right? Like you all in the audience right now are studying related kinds of concepts, but even what the four on the screen, our four alums are experiencing, things are shifting. So I'm wondering if the four of you can talk about trends in the field and things to consider as people might be moving into this area.
I thought of some stuff right away, but I don't know if I should go.
Okay, Aranza, you're first. Liz, you're second.
Okay, sounds good. The first word I thought of was systematic. Upon graduating and entering Hennepin County's department, their public health, they had good focuses. They were focused, they cared about people, but did they expand really challenge people? I wouldn't say so yet when I first entered in 2019. The pandemic happened and the terrible occurrence with George Floyd happened, and Hennepin County knew they needed to make some changes. So within public health, they declared racism as a public health crisis. And now things are moving more systematic into opening people's minds and awareness of how they're interacting with others. Are they really including others out of their own beliefs, or is it like excluding because of their own biases? There's a lot of conversation surrounding levels and interconnections and how things are working together on a systematic level that either separates and creates more inequalities or gaps. So right now in public health, I think most of us would agree things are moving in a more holistic manner and really expanding challenges to touch all levels and all in different areas. Yeah, so I just wanted to add that.
Yeah, and that's exactly what I was going to say too. Just like the concept of public health overall, I feel like is still kind of in its booming stage, where people are kind of realizing that all of the social determinants of health play into how communities interact with each other, how we, like the health systems provide services as well. So it's like hitting all of those areas. So like, if you don't have food, then like your health is going to be impacted. If you don't have a home, you're going to be impacted. If you don't have transportation to your medical appointments, like those are all disadvantages that I feel like public health is trying to bridge the gap between, where like you might not think transportation is related to health, but it's integral in like everything.
I appreciate those specific examples because I think thank you.
Mm-hmm.
So Tessa and Jake, do you have kind of thoughts on trends you're seeing from your work angle or life angle?
Yeah, I was also going to talk about the social determinants and being ready to look at health inequities. So that is, I will just echo that. But then I also wanted to say that I'm seeing a big trend in collaboration. I think that this was something that I had a really good foundation in at St. Ben's, and then also in my graduate program, was that nothing happens as an individual. Like, so you will have individual projects, but then oftentimes you are meeting with different stakeholders, having those conversations. So being ready to work on a team and be able to compromise, to ask open-ended questions, to make room for different opinions. I think that's really important. And then with that, in your collaboration, being able to ask the question of like, these are the partners that have always historically been at the table, but whose voices aren't we hearing?
Yeah, I would say on my side of things, guys, with just me working a little bit more in direct patient care, we're actually starting to see a big shift and focus around people not relying on the doctor for their health. Not to say that doctors don't serve their time and place, but we're actually starting to see a lot of a bigger, more emphasis on the work of dietitians, which is really, really great for us to see more of that preventative approach. And we're starting to hear this too from our business partners. So one of our locations down in Florida, for example, which is like a staggering statistic, but they're a healthcare system. They spend $100 million a year on healthcare costs for their own employees. And they're seeing that, hey, America's getting sicker and we're spending more dollars in healthcare and we're not getting that return. And so you're starting to see a bigger shift in emphasis on preventative care and being proactive with your health, working with the dietitian, working with mental health specialists and psychologists, going to the doctor when it's appropriate. But we're actually starting to see a lot of our business partners are actually bringing us on board on, first, how do we get their employees healthier to get their healthcare costs down? But then two, how do we actually go and impact those communities, those patient demographics and populations to get healthcare costs down and actually start to move the needle on that community health overall. So that's a big, exciting thing. And that was one of the reasons why we decided, hey, all of our locations now are required to have dietitians on staff, physical therapists, mental health, all of that. So really, really exciting stuff to start to see.
I think based on what you're saying with that, I think maybe it's just because I'm a different vintage and slightly older, but these are some of the conversations I have with friends, right? Of as you all move into the world of work or kind of whatever your life after St. Vincent St. John's looks like, things like even benefits. And I think that is starting to shift too, kind of like, I don't want to take what you were saying, Jake, and move it in a wrong direction, but like those are kind of some of the conversations I wind up seeing too as we work with students in terms of like, well, what kind of overall benefits are there? How can an organization help keep you healthy as a human who happens to work at that organization versus just the I'm sick and then I go to the doctor, the preventative piece. So those are things to think about too as you move into. I don't know if anyone has thoughts on that, but
it's a great point you bring up too, Angie, because like I look at like my own employer right now, they actually pay for me every single month as far as working with a trainer, you know, doing my lab testing, taking the right type of supplements if necessary. Like they're actually investing in all of our employees around, and especially our leadership team of, hey, what is that work-life balance? And I even look at like the actual benefits now too. They have one of our benefits packages, they actually have mental health coverage covered. So our employees actually can work with mental health specialists and all of that. And that's a big emphasis for our company, is just overall making sure, hey, we're taking care of our employees so that they can go and make impacts on the community. And we're starting to see that a lot now too with our business partners, as they're investing in our company to take care of their employees so they get healthier. So that's a big important thing too, guys, because when I first got out of school, I didn't really ever think about the benefits side of things. And just the different evolutions I've kind of gone through with that too, and what your employers are willing to invest in you is, it's a big deal.
Yeah, and I'd echo that. Even like beyond health benefits, just like entering a work environment that promotes overall well-being. So that includes like being able to take PTO and being able to have like that work-life balance on top of being able to have access to healthcare and mental health care and everything like that as well.
and please know, I mean, I know you're, again, all the fabulous people in the audience, you range from first years to seniors. So some of you are closer to this reality of asking the questions of like, what does a benefit package look like? Please know, you're not supposed to just like magically know this off the top of your head. Like this isn't necessarily, some of you might, but please know, XPD, we can help you brainstorm, right? Like what kind of an offer did you get? What kind of a benefit? What are other questions you can ask to start to get to these other things? You don't necessarily just have to know this. Most people don't. So I want to normalize if you're like, I don't know anything about this, we can help you with that. So, or
That
Liz.
was me. That was me.
Right? It's like,
Yep.
or maybe Liz is pointing that she can help you.
No, I was in that situation. I still don't know everything, but you can navigate it. You could you figure it out.
It's way doable.
Yes.
So I have more options for questions, but I would love to actually flip this. And again, to the four panelists, I know the view you have of everyone is not the most amazing. Like we did what we could with our cameras. But I'd love for you all in the audience, what questions would you love to have one or all of the four answer? And what I'll have you do is raise your hand, ask your question. I'll repeat it in the microphone so that the four can hear. And I'm super comfortable with uncomfortable silence. So what do you want to know from these four amazing alums who have taken time to hang out with you today? I see a whole bunch of people not making eye contact with me. I see you. What do you want to know? Yeah, thanks.
I just had a question, like, I know a lot of you didn't start off as nutrition majors, but like, was there a specific class that like made you switch, or was there like a moment where you're like, I need to switch?
Yeah, so if you can talk about, the four of you can talk about kind of like when you knew, like, was there a specific class you took? Was there a specific experience? I don't want to misrepresent your words, but often I do hear that people don't necessarily plan to go into public health. They stumble into it. And so what was a class that intrigued you, or an experience that started to lead you down a path you didn't know existed?
I can speak on that. I mean, I think we all can, but I actually started off as a criminal justice major, and I was through my first year, I was going to a different school, and my father actually had a massive heart attack at 51. And I realized at that point, like, hey, like that's actually the field I wanted to go in. I wanted to help people in that realm. So I made the switch, and it was actually my tour of St. John's and St. Ben's that I just realized, hey, I need to be a part of this community. And so it was, I started with that, and I want to say my first class was actually with Alexa. But regardless, I mean, I think as soon as I stepped foot on campus, I realized like, hey, this was the right decision for me, and I haven't regretted it for one day.
And I can speak to that as too, because I kind of have a defining moment. I expected coming into St. Ben's that I was going to be a biology major, because I just thought that's what you had to do for pre-PT. But on one of my tours before I applied, we were able to tour the food labs, and they had some projects of people who had made these black bean brownies. And for some reason that really lit a fire within me. And I was like, what, like, you can do this? Like, this is a career path. I want to do that. So that really got me switched over to nutrition. And I think Linda's class as well, it was either 223 or 323, the nutrition throughout the life cycle. I remember that class being really pivotal for me and like addressing those public health crises throughout people's lifetimes.
Yeah, Tessa, Aranza.
So
Go ahead, you go first.
thanks. So I thought about my first year seminar class and how reading specific topics of like Henrietta Lacks, a Black woman whose cells were taken without her consent, and to promote more lab cell like interaction and research. This was way back in the 70s. We read a book on that, and we read books on how different health measures that were very unethical occurred in history, and current American systematic issues, and that grabbed my attention so much my freshman year. But I knew it was health. Like, I knew health was the core that I wanted to learn, and if it wasn't going to be a specific physician assistant route, I wanted to be somewhere where I could be with people, and I saw being a registered dietitian was the opportunity for that. At some point, I knew the direct hospital clinical side of a registered dietitian wasn't for me, because I wanted a population focus and I wanted a community bigger, wider focus. And at some point, like Angie said, I stumbled upon public health and understanding it more. And that helped me understand where it was that I wanted to go next. But truly, for my path, it wasn't without the work experience first that I found out a graduate degree, a master's degree was going to be for me. So for me, I needed the work experience graduating after 2019 to decide what graduate program was going to be for me. And then 2 years of that helped me, 1 year and a couple months helped me decide what program. And yeah, that's something that I wanted to add there. Yeah, I have more things to say. I think to graduate students, just please use your seniors, use your winters, use your breaks to see people if you can, Zoom people, because I know classes get you tired. I know winter gets you tired, and as we approach the night, it gets more tiring, and you just want to cozy up and not stress too much, because the winter can stress and overwhelm people. But please use your breaks, the winter breaks, spring breaks, please use them to at least make 1 or 2 informational interviews with people that you're interested in learning about their career path, because you won't regret it when you're done and you have background, you have things that you can be rooted on.
And I know, Tessa, you're gonna it looks like you were going to add some things, but if I can really quickly, just again, on tagging on to what Aranza said, again, we can help you. Turns out, I mean, you've heard this, you've likely heard it on campus. You've also heard it from our alums on the screen today too. We have a really amazing alum network. And I think until you start to really engage in that, you're like, oh. So when Aranza has talked about doing informational interviews, I'm seeing Liz nodding her head profusely. Thank you. That truly, right? Like if I ever, even when I didn't work here, right? I should have mentioned I'm also an alumna. So at any point in history, if anyone has ever reached out to say, I'm a Benny or a Johnny, can I talk with you? I will carve out my day, always, 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 always. And I am not unique in that. And so we can help you figure out what fields are you looking at. Here's some alums. LinkedIn is a really great place to find amazing alums. We've got good connections with the alum offices. So no, again, this is one if you're like, I don't know what an informational interview is. I don't know what questions to ask. I maybe have an idea, but I could use a few more. I'm not sure how to approach this. Again, come into our office. Again, some of these things aren't things you're necessarily like born knowing. We can help you with that. But alums really are excited to connect with you because they've been there. So Tessa, I didn't know if you were going to add something.
No, we can definitely move on to the next question.
Okay. You all saw that someone asked a question and she's still alive to tell the tale. So she made it. So what other questions? Who else has a question that you've been thinking about? I literally see some of you like turning your head to make sure I don't even see your eyeballs. Or what things has any of the alums said that resonate with you that you're like, okay, that's interesting. Give me at least one more. Yes. Yeah, and so what he's articulating is the connection that I think Liz mentioned, a few of you kind of dabbled in it, that you don't have to know ahead of time that, you know, you switch sophomore year. And I don't want to take words that weren't out of your mouth, but like it's nice to know that you don't have to have things predetermined and pre-mapped out. I don't know if any of you want to talk about that.
I can kind of add to that. So yeah, I came in thinking I was going to do pre-PT. And then after I kind of decided that wasn't the right fit, I knew I didn't want to be a dietitian. But I knew I wanted to end somewhere in the public health field, which is so expansive, which is a blessing and a curse because there's so many options that you can do. It's more just like finding the right path for what you're interested in. Yeah, because I definitely remember feeling that because all of my roommates were nurses and teachers. So all of them had like their direct paths of their careers that they were going to go on to after college. And it just requires a little bit more research and effort into what you're interested in and like how you want to continue after school is over.
Thank you. And I like that, that connection to things like education, right? There is some comfort if you're going into education or if you're pre-med or those things that are what can feel like a more linear route. I major in education, I do my student teaching, I become a teacher, done. Like there is something really comfortable within that. We have a lot of people also, I'll kind of take the pre-med example. A few of you talked about your path that you might have come in as like bio pre-med or pre-PT, physical therapy, or PA, physician's assistants. And we see this a lot, right? Like everyone, as you're coming into college is like, well, what are you going to major in and what are you going to do? Partially, I like to say they ask it because people don't know what else to ask you. And so when people keep asking you, it makes it feel like you're supposed to know. And again, what I'm hoping you're hearing is that you actually don't have to. And while it gets hard then, right? Like the education example. Okay, well, what happens if what I've been telling people I'm going to do, I'm actually not going to anymore? That's scary. But then again, this is where I think I'll go back to Aranza, you're now going to be the owner of informational interviews, but like where informational interviews can really be helpful, where you start to hear, oh, what I'm thinking about is completely normal. Like other people have tried to figure this out as well. I have one other, I'm trying to, maybe. We have about 5 minutes. So I want to see if there's one more question. I will also say, Linda and Emily, if you have things you would like to make sure these fabulous alums, because you all know these alums really well too. So if there's anything I want to put it out to you too, I have other things, but I think Linda might have something.
I just wanted to say hello so that you can hear my voice, and hopefully that brings good memories from class. So thank you so much for today. Okay. Where is the camera? A few things definitely stood out. And one of the things I think for a lot of students in our audience is collaboration, because I know that some of you might have other goals, you might go in different directions, but public health is very interdisciplinary. So it really goes well with a lot of different majors and interests. And one of the things that's at the core, I think, is being an advocate for your clients and having some passion and to be familiar with resources that are in the community, because we do have a lot of challenges. So Aranza talked about racism, and Jake talked about prevention, and Liz talked about, you know, food insecurity and what social determinants of health, and Tessa definitely talked about how it's important to work together and be an advocate. So that's one of the most important things I think in public health. So anyway, hello. Thank you for coming, and Emily is here
I
too.
didn't know if Emily, do you have anything you're dying to hear speak about?
My
I'll repeat
favorite
it then.
questions to ask when I do things like this are, and I normally have talked about this in this left, so tell us, one, what is your favorite thing about your job? Two, what is the most difficult thing about your
Ooh,
job?
great question. So I'll repeat that. Is what is the favorite thing about your job, and what's the most difficult thing about your job? Yeah, and we do have a pretty hard stop in about 4 minutes, so you each have 1 minute.
All right, really quick. Favorite thing about my job is being able to coach and develop other dietitians so that we can make a bigger, broader impact versus just my own clients. Now I know, hey, there's plenty of other people that are being taken care of, and we're having a larger impact in the community. Least favorite thing about my job is probably the time zone differences and having to travel. I do like traveling, guys, but when you go through different time zones, multiple weeks in a row, it gets a little taxing. So if any of you guys have the opportunity to travel for your jobs, it's super fun, it's super exciting, but just make sure that you're taking care of yourself too.
Tessa.
I can go next. So my favorite thing is being able to see how these higher level policies and research impact some key food assistance programs that actually are improving the health of US populations. I would say the hardest thing being at the government level right now is just the speed that things move, and having to be patient, understanding that there's a lot of bureaucracy involved. Yeah.
Thanks.
I can go next because mine kind of follows that. My favorite part is just being able to connect with people across Minnesota and getting them like the help that they need. Definitely the hardest part of my job is a lot of it is limited by policy, whether it be at the state level or the federal level. So it's just out of your control and it takes time, but just helping people navigate that process is a really cool opportunity.
And I will say, so I was with Hennepin County WIC right before starting school. So I'm not with them anymore as a WIC nutritionist, but I thought of things right away. When I was a WIC nutritionist, my favorite parts were speaking to mothers that were from all parts of the world, from Africa, Russia, France. I had Mexico, I had Ecuador, like these interactions that I had with mothers that were from all different parts of the world and all different parts of the US, and traveling into Minnesota was one of my favorite parts. Hearing different stories, hearing different backgrounds, and seeing different little kids. Just love seeing the family interactions and the one-on-ones that I had with them. But what was difficult again, and this is why I'm studying also the policy and administration side, is the limitations that I think policy has on our families and mothers that are low income or immigrants. So yeah. And I'm starting a position with MDH, the Minnesota Department of Health soon next week. So if anybody wants to talk about the county level versus the state level at some point, I'd love to help with that.
Fantastic. I want to thank you all as alums. You've taken time out of your day. I hugely appreciate that. I want to echo what you've all repeated and kind of talked about, and also Linda brought up that to some extent, public health and your areas you've gone into, nutrition and public health, is almost, it's the liberal arts interdisciplinary piece, and you're living it out every day. So I appreciate you all sharing with our amazing students here today. And for students, I thank you. I thank you, especially those of you who asked questions and you dared to ask. And if you want to connect with any of these alums, please reach out to me. Both Emily and Linda know how to get a hold of me. Otherwise, literally just look us up on XPD and I'm happy to get you connected to our alums. And before you leave, don't forget to make sure you signed in, because that's your attendance for the day. Boom. So thank you all for coming. And then the